Okay guys, I apologize for the abrupt ending of the last video. There's a 15-minute limit on the software I'm using, and I thought I was going to make it and didn't quite do it. So I'll finish up quickly in this video. We were talking about, in the previous video, control of breathing rate. And there are a few places where it's controlled. Primarily it's controlled in your medulla oblongata. That's where your respiratory rhythmicity centers are. There are a lot of details that you could learn about this. Your dorsal respiratory group versus ventral respiratory group. I don't need you to remember all that. Just remember that essentially, and this is oversimplifying it a bit, your normal rate of quiet breathing is controlled by your medulla oblongata, whereas your pons up here adjusts that based on feedback. Right? So can increase or decrease your rate of breathing based on the needs of your body. So that's pons. You have higher centers that control this too, right? Hypothalamus and limbic system, for instance, the aversion and desire centers, obviously, those things can change our breathing rate. And cerebral cortex is your breathing rate consciously controlled. Right, so cerebral cortex is your seat of conscious thought, and whenever you want to, you can overrule everything else and just say, right, I just breathed, or I'm going to hold my breath for a while, I'm not going to bother breathing, right? You can overrule the rest of those, right? So what kind of feedback are we talking about that our breathing rate is going to respond to? Well, one thing is blood pressure. Right, so baroreceptors, as we've talked about previously, detect changes in blood pressure. Baro, like barometric pressure, right? And we have baroreceptors in several places in our body. We talked about our aortic sinus and our carotid sinus at the base of our internal carotid artery. When our blood pressure drops, that means that we are probably not efficiently delivering the oxygen that we have in our blood to our tissues, which means we better get more oxygen in the blood that we are delivering. And so that means increasing your blood, or your blood oxygen level, which means breathe more, essentially. So as your arterial blood pressure drops, your respiratory minute volume is going to go up. You'd better have more air coming in and out of your alveoli for exchange per minute. And you can do that in two ways. One, increase the rate of respiration, or two, breathe deeper, get more oxygenated air in per breath, right? So breathe faster, breathe deeper. As your arterial blood pressure goes up, your respiratory minute volume will likely go down. Right? As with most of our body systems, as you get older, they stop working quite as well. In terms of your lungs, they're not going to be quite as elastic as they used to be, so they're not going to bounce back when you breathe out. Your ribs may not be as movable, and so your compliance is going to be smaller, and so the maximum amount of breathing you can do is smaller. You can't breathe as deeply. And everyone has some degree of emphysema as they get older, right? You just have a little bit of lung damage. Right? So even if you're a marathon runner, right, who's never smoked a day in his or her life, when you are 70 or 80, your lungs are not going to be as good as they were when you were 20. That said, they're in much better shape on average than they would be if you do smoke. So you can see the drop from here to here, right? If you are 50, your lungs are at 70% capacity as opposed to maybe 90% capacity, right? When you are 75, well, your lungs may not even be working because on average, these are kind of old statistics, but on average, you're not going to be alive to be breathing, right? So that said, if you stop, right, even if you stop in your mid-40s, right, you can really, really change the shape of that curve to where you still have almost 50% of your lung capacity when you're in your mid-70s. Even if you stop at age 65, you can add years to your life. Now imagine if you stopped at age, so we started at age 25 down here, right? Started at age 25. Imagine if you stop at age 37 and a half or whatever this is, right? Anyway, the earlier you stop smoking, the better it is for your life expectancy. Speaking of smoking, the vast majority of lung cancer cases, 85 to 90%, are directly caused by smoking. Now, you can get lung cancer without smoking. Obviously, it happens. But most cases have a link to smoking. And smoking kills more people per year than any other kind of cancer. It kills more people than colon cancer, breast cancer, and prostate cancer combined. It's a very deadly kind of cancer. Now, how does that happen? Well, by the way, it happens more often in males than in females. By the way, smoking rates are much higher in males than they are in females, although, as you can see, they're coming closer together in the last 30 years or so. These are relatively old statistics. I think they've gotten better. There's a little less smoking now than there was when I was a kid. What happens when you smoke? Well, first of all, you get dysplasia. And this is where your cells begin to get damaged in your trachea and bronchi. So where you have that pseudostratified ciliated columnar epithelium, those cilia get paralyzed. And so those cilia are not able to move that dirty, dirty mucus up and out, so you can get rid of it, right? So how do you get that dirty, dirty mucus out of your respiratory tract? Well, the smoker's cough, right? We've all heard the smoker's cough, and it sounds terribly uncomfortable, and it's because it is. I can tell you that was uncomfortable just then. So that's how you get the mucus out. Now, this is reversible, right? So as long as you quit smoking, you can recover that function. After dysplasia, we go to metaplasia, and this is where the tissue is so damaged that it begins to change in structure. We mentioned that in places that are damaged more often, like in your mouth, right, where you got a lot of food scraping around there, you tend to have stratified squamous epithelium instead of pseudostratified ciliated columnar epithelium, because multiple layers of cells protect you more. Well, that's what happens to your tracheal and bronchial tissue. It turns into stratified epithelium. Again, this is reversible, but as that tissue begins to change and the cells begin to divide, you are also, because these are carcinogens we're talking about, causing mutations in the DNA that govern cell division, and you can end up having out of control cell growth, and that's where we get into neoplasia and anaplasia, where we are now forming tumors. And in anaplasia, those tumors are malignant. They are diving and invading nearby tissue, causing damage, and possibly even metastasizing to other parts of the body. Anyway, so I guess stop smoking is my point. Thank you for listening, and I apologize for having to make a second video.